how working is not just important for your CV, how it is important for attempting this exam, which is so clinical.
Because as we are working, especially in emergency department, we have to see cases each and every day, and different cases of types of cases come to us every day. And
so, like a lot of students are making mistakes where the two options are very close.
So I first study the therapeutic guidelines, what they are usually doing, and then individualize it to each patient like that.
Even though I have personally told them, don't look at the new questions, instead revise them again and again. Yes, but today, you are my example that will validate my claim. Good morning, everyone. I'm Dr. Ssnegdha Sharma, academic head from Academically. And today, with us, we have Dr. Anwar. Dr. Anwar received his AMC result yesterday. And that just makes us happy to tell you that he has cleared this exam with flying colors. So, Dr. Anwar, please, congratulations, first of all.
Okay, thank you.
And please tell us about your journey with AMC.
Okay, I started preparing in the last November time. Then I got a little bit delayed due to some personal reasons, and I get into my serious preparation in this August. Okay, I just took about only 2 months to complete this. I just focus on these important topics only. I didn't.
Wow, Dr. Anwar, you did the best crash course. Like, this is the first time I hear someone who's done this exam with a preparation of just 2 months. Please tell me all about it, please.
Okay, I just focus on the important topics. So I didn't read it too much or didn't think about too much. I just look into the important topics which have come through the last 1 year. Just focus on that things. I kept revising those questions and kept revising those topics. The main theory part only. I didn't read too much into it. I just take the guidelines, the therapeutic guidelines. What are the type of questions? How that they can twist the questions? Main investigation, that thing. Okay.
So,
as I was working that day.
How were you dividing your time? Because it was just 2 months. First of all, how many hours per day? How much time to read the theory, and how much time to do MCQs per day?
Okay, I didn't take too much time in reading theory. I just kept doing the questions and then read the explanation to that questions. Then it contains all the information, if the relevant information about how much we are going to, how to investigate a patient, what are the clinical features we have to look into that questions, differentiate it from other answers. Like that. No, I didn't read too much theory from top to bottom. No, I didn't. That's why I take 4 hours daily. That's because I was working that time in ED, casual emergency department, so I didn't get too much time. So I keep to my time.
Oh my God, Dr. Anwar, like you were working plus 2 months. Dr. Anwar, I have to believe, I don't even have to ask this question, and I have to take it as just an outset baseline that your clinicals are very strong.
Yes.
Yes. So now that you told me that you were working in the emergency department, I want you to utilize this interview to tell the students how working is not just important for your CV, how it is important for attempting this exam, which is so clinical. Please.
Because as we are working, especially in emergency department, we have to see cases each and every day, and different cases of types of cases come to us every day, and most of them are emergencies. Some like that OPD basis cases, and we can also look into the IP patients. Also, we have to do, as a resident medical officer, I have to take care of the IP patients also. So I have the opportunity to see different types of cases every day, and this kept my clinical knowledge up to date. So that it helps me in the exam. When I am reading a question, I can relate it. This is the condition, but I just have to adapt to the Australian clinical setting. So I just have to read the investigation wise how they are, like that only. That's why I have maybe clinical basis very good. That's why it's easy for me to achieve it in 2 months.
Thank you, Dr. Anwar. So this is, guys, for everyone who asks me, this is a very general question. How much is working important? And most of you are asking this question according to your CV building. But see, Dr. Anwar is a live example that if you're working, if your clinicals are strong, that is not only helping you with CV, but implementation of that knowledge while you're attempting that exam. Right, Dr. Anwar?
Yes, yes.
And Dr. Anwar, one common thing, we all know AMC is notorious to using two options which are very close. They both will look correct. Like I recently had a question about a stroke patient. Okay, and he was a 72-year-old male, asymptomatic, just found out that predisposed to stroke, not actually a stroke patient, 72-year-old patient, asymptomatic, more than 70% of stenosis. Now, there was an option, there were two options. One was CEA, to do a CEA on patient. And the second option was, we'll make some lifestyle changes and we'll monitor the patient. So these two options looked very correct. Now, my students were confused, why not CEA and why to send on lifestyle modifications and the medications. So these kind of questions that are very common. How do you tell students to go and approach such questions? Please, if you could.
It's really about the last system of what they are asking. If they are, what's the most initial investigation, or what is the most initial management you have to do to that patient, and you have to look at others about what's the age of the patient, what's the life expectancy. We are explaining what's the any other comorbidities like that. We have to practice more questions like that to get more familiar with the answers. What AMC is thinking.
So, like a lot of students are making mistakes where the two options are very close, but because there are times you don't read the guidelines and you don't have the time to go through all the guidelines, and you never know where the question is coming from. So how do you attempt the question in a way that you're able to deduce the answer easily and properly? Do you have a trick to tell the students, rest of your fellow colleagues?
Actually, I told you, my main trick is I kept revising the same question so many times. So I get this is what they are thinking in every situation. So different situation, same question, I just kept revising it. So I first study the therapeutic guidelines, what they are usually doing, and then individualize it to each patient like that. Actually, AMC is individualizing the questions according to the patient, a real life scenario. So we have to just keep revising. That will make us familiar what they are thinking and how to proceed with each patient like that.
Yes, thank you, Dr. Anwar. This, your story is an inspiration right now. I don't know how to, even I'm finding it difficult to digest that you prepared just for 2 months, and that too, but just for 4 hours.
Yeah.
So guys, you can take this as an inspiration and go ahead preparing well for your AMC exam. One thing that I would like to highlight from Dr. Anwar's technique was he limited his resources. Like now that Dr. Anwar, eMedici is there. Now everyone is asking, okay, we have done Amidex, we have done Academically's question. Now should we go and attempt eMedici? Even though I have personally told them, don't look at the new questions. Instead, revise them again and again. But today, you are my example that will validate my claim. Instead of attempting newer questions, just keep repeating what you already know. And that will be the key. So thank you for validating my claim that you have to just completely repeat whatever you have done.
Yes.
That was an amazing story, Dr. Anwar, and I'm really thankful I got to connect with you, and that inspiration I can just try and give it to the other students who are appearing for the November session.
Okay.
Congratulations once again, Dr. Anwar. And we as Team Academically, we are glad we were part of your journey. We were able to help you crack this exam in a short span of 2 months.
Okay, thank you very much for